Hey everybody, Amanda Russo here with Keller Williams Collected, and welcome to Move Forward with Amanda. On this podcast, I love to bring in some resources from around town to discuss different things in aging. And today I'm so excited to have my wonderful guest, Tracy Tanner with Hosparus Health, as well as Ada Rothrock with Dignity Memorial. Welcome, ladies.
Thanks.
Hi,
Thanks for
Amanda.
having us.
So glad that you guys are here today, and we're going to talk about some things that might not be the most fun conversations that everybody loved to have, but they're still really important as we age and we talk about that process. So first off, I want to give you guys a little bit of a chance to introduce yourself and how long you've been at said company, and then we'll get going. Tracy?
Yeah, thanks. So I'm Tracy Tanner with Hosparus Health. I've been with Hosparus for 13 years now. I am the Executive Director of Business Development, but my main role is that I work with our outreach team. And what we do is go out into the community and we talk to physicians and social workers and hospitals and nurses, and we do community events in churches. And we talk about what hospice and palliative care is and when to elect those benefits and dispel the myths that keep people from using those services. So it's nice to get out and talk to people and get the feedback of people that have utilized our services and hear all the wonderful things that we've done.
Yes. And what about you, Ada?
Yeah, so Ada Rothrock, and I'm with Dignity Memorial. Dignity Memorial is one of the largest funeral home and cremation providers across the country. Locally known, we are Archel Hetty & Son Funeral Home. So we currently have about 15 locations around town, most recently acquiring Shopping Horse out in Bullitt County and Mount Washington area. So we are able to provide care, pre-planning and funeral services, along with cremation, basically anywhere in your community. But my focus is education and encouraging individuals to get some pre-planning in place sooner rather than later, and just having those conversations with your families, because we just never know when we need to know what to do.
Yeah. And that's the great thing about our conversation today is I want it to be educational so that people can understand what these services really offer. And I'm always talking to people about, as they're moving into senior living communities or things like that, they're having health changes and they don't know when to bring in these types of services, especially with the palliative and the hospice care. Or we're always talking about planning. And a lot of times we're talking about documents or putting together trusts, and then people stop
Exactly.
when that next very important step still needs to happen. So today I want to get into some of the myths and exploring these services and what families really need to know before they start these conversations with their loved ones. So one thing I think that's really important, Tracy, is explaining the difference between palliative and hospice. And going into that, and I've heard sometime another one of your colleagues talking about taking the H out of the word because there's a lot of fear, I think, with that, which there shouldn't be. So explain some of that for us.
So I think to explain the difference between hospice and palliative care, it's important because a lot of times people lump those two together, and there are some differences. So hospice care is if someone has a life-limiting illness and they've decided to stop their treatments. They're no longer going to do physical therapy, home health. They're going to stop all of that and focus on the best quality of life for the time that they have left. And it's a guess that they have 6 months or less left. So it's important to say that it's a guess because sometimes we can have people on hospice care for years, but unfortunately, most people think of hospice care for the last few days of life. So that's why we like to explain it's a Medicare benefit, 6 months or less. But if it goes beyond that, then we can keep people on service. So think of hospice care as being more prognosis driven with that 6-month parameter. Palliative care is more needs-based. So you can have palliative care at any age or any stage of your disease progression. So it's more symptom management. We're walking alongside the patient to help with any symptoms that they might have. They're still seeing their physicians, but we're coming alongside them to help with some of that symptom burden, guiding them through what's going on, providing resources so they can have palliative care with any serious illness, chronic illness, but it doesn't necessarily have that last 6-month prognosis.
And so where can these services be provided? Do they go in the home or
Yes.
like assisted living?
We provide care wherever somebody calls home. So the majority of our patients are in the home, but we go into nursing homes, assisted livings, hospitals. So we can provide those services wherever somebody calls home.
And if somebody's looking to bring in this service for themselves or for their loved one, what can they expect to get? Like what types of services come with those care?
So we always say if someone is hospice appropriate, they really need to use that hospice benefit because you get so many supportive services. You have this excellent team is overseen by a palliative physician, nurse, social worker, chaplain, CNAs, grief counselors, volunteers. So you get so much supportive help that is all covered by that Medicare benefit. Medicaid covers it. Insurances generally pay at 100% to provide all of that care. We can pay for medical equipment, medications related to the diagnosis. So many things are covered. But again, that H word is scary for people because of all the myths associated with it. So sometimes people prefer to go the palliative route, which we want to meet people where they are and be able to support them and care for them. But again, if they're hospice appropriate. So anybody that might be going back and forth to the hospital quite a bit, maybe they're getting frequent infections, UTIs, they're losing weight, they're not eating as much, they're needing more and more assistance with those ADLs, activities of daily living. Those are some triggers to look for to possibly bring in hospice care or palliative care so we can provide those resources to them. It's frustrating to us because we always hear what a blessing we were to these families when they are maybe at the end of life or they're declining. And then yet we see that people either wait too long to call hospice or they don't utilize that service at all. So we just want to get the word out to not only let hospice come in and provide those resources for you, but to call us much earlier and not wait so long.
Yeah, I heard a statistic not long ago. What's the average stay? I say stay, but what's the average service time for a hospice patient right now?
So again, that benefits for 6 months. We can care for people longer. We answer to Medicare, so we have to qualify them. We're not just putting people on service willy-nilly. They qualify for service, but we can extend that service. But unfortunately, the median length of stay is less than 2 weeks. So they're not getting the full benefit of the care that we can provide in that short amount of time. The other part of that is anybody can make a hospice referral. A lot of times people feel like they have to wait on their physician, but anybody can make a hospice referral. So we just encourage people to call us earlier and not wait too long. Most of our referrals are coming from the hospitals, about 60% of them, and that's usually when people are actively dying. So we want to be called on that second or third hospitalization where we can get them home where they want to be and keep them from going back and forth to the hospital because that's exhausting on the patient, it's exhausting on the caregiver. That people want to be at home, and we want to help them do that while focusing on the best quality of life.
Yeah, and you mentioned that caregiver, and if there's somebody that's going through this at home, then you have caregiver exhaustion, and they're not really getting to spend this however long this time is with their loved one, but they're not getting able to spend that and enjoy that with their loved one because they're taking care of them.
You're absolutely right. We always say, let us come in and provide that medical component, the spiritual, emotional support of all of that. And let's let the caregiver step back and be a daughter or a sister or a brother and not have to be the primary caregiver. We don't want to take anything away from them. We want to support them in that. But it's just amazing the burden that we can take off of them by providing that support.
So Ada, now we're going to talk about that next step and planning, but the gift that people can give their family typically is doing this pre-planning of the funeral beforehand. So talk about those services and why that conversation is so important to have early on.
Absolutely. So it's so important to have the conversation way before the time of need, obviously. even before we've had any kind of a diagnosis or we are entering into an end-of-life care. Pre-planning your funeral and cremation truly is for any age. We know that death does not know any age. Death does not know any situation. But again, it's a part of that I like to call adulting. So it's just the opportunity to have these conversations with your loved ones about what you want. What do you want to have happen at the end of life? Do you want to be cremated? Do you want to be buried? And what funeral home do you want to go to? So at the time of death, that's not when people should be shopping for a funeral home. We are in a very emotional state. It's raw. There's a significant amount of fear on what to do next. So the more that you can truly prepare, it's just an amazing gift for your family and for your loved ones. It's great.
So yeah, I think it is great to start having those conversations early on. And then what would be some of the benefits? Like you talked about removing some of that, I'm sure, stress when you're already going through an emotional and stressful time. But are there other benefits that come to sitting down and having that conversation prior to the death actually occurring?
Sure, yeah. So having the conversations very early on, pre-planning just is a huge benefit in itself. We talk about our estate planning, our living will, and our power of attorneys and our trust. Again, pre-planning your funeral and your cremation is just one of those next important pieces of documentation that you should have in place because you have the opportunity to make decisions when you're clear, when there's clarity, when there's not any emotion running you ragged, and you're not exhausted. So, you're making those decisions about what's most important to you. You're getting things documented. You are having these conversations with your loved ones. And financially, the biggest benefit about pre-planning your funeral or cremation is you're locking in today's price. As we all know, inflation is just kicking all of our butts in every aspect of life. But when you pre-plan, you're able to secure that cost today for the future, no matter when that future is, 2 months, 6 months, 20 years, right? So it's just, again, a financially advantageous opportunity to take that financial burden off of your family in addition to the emotional burden.
And what if somebody plans now, but maybe they don't live in the same state or the same area as when they originally made those plans? So how would you handle that?
Very good question. So one of the biggest benefits of Dignity Memorial being a national company and Archel Hetty locally, your pre-arrangement is nationally transferable. So if you were to move to Florida, you can take your pre-arrangement with you. If you were to move to California, you can take your pre-arrangement with you. But the most important thing is if you were traveling and you were to pass away, our goal is to be one phone call for your loved ones. So if you were to pass away, call us still and we can get you home.
Okay.
We can get you home because, again, it's taken that emotional burden off of your family by just one phone call.
Yeah, because that's good to know because I guess people don't think about that. And it does happen.
It happens all the time.
When people are on vacations or cruises or things like that. And how do you get them back home?
Yep, exactly. And I think the thing with, pre-planning and people reaching out for hospice care or palliative care, it's the fear of the unknown. It's the fear of picking up that phone and just making that phone call when it's just such an amazing opportunity to get the help that you need way sooner than, most people reach out to get that help. And ask questions. It's okay to inquire about what these services are. What does it mean? Because you don't know what you don't know.
Well, and as a culture, we don't want to talk about death, dying, funeral planning. It is so taboo.
Yeah.
And so I give people so much credit that plan for these things because we just absolutely don't want to talk about it.
No, people don't want to talk about it at all.
Right. It's all about sooner rather than later. Be proactive rather than reactive about anything, pre-planning or reaching out for hospice.
People always want to try the next thing, the next treatment. They want to keep pushing for PT. It can be frustrating when we see a family and they have a 90-something-year-old loved one that is declining and they're still pushing for treatments or feeding tubes or more physical therapy. And you always want to say, talk to your loved one. What are their wishes at this time? And most people are shocked to hear that they're done.
They're tired.
They're tired. They want to have good quality of life. And so that's why we always say, again, going back to that dreaded H word, is take that out of it. And it's not about giving up for either conversation. It's about refocusing and taking control of your situation. And control is a very powerful thing. So take that control back. Have the dignity at the end of life. Be able to be at home in your recliner with your pets and not in the hospital where most people don't want to be.
Yeah.
So it's all about conversations. And as hard as they are, they feel so good once you've had them and you have some clarity about what's going on.
And it's all out in the open. And I think the kids will feel better because they have to be worried, when these processes happen. Like, did I do what mom and dad or whoever wanted? What did they want? Because we didn't talk about it or they didn't talk about it because it was so taboo, and you just don't know if you did what they wanted or really honored their wishes.
Well, and I think both of us, Hosparus Health and Dignity Memorial, we always hear all the time, we wish we would have called you sooner. We wish we would have called you sooner. And I've never met a daughter or son or a spouse that said, wow, I wish they would have never pre-planned. Never, ever have I heard that. So it's like, oh my gosh, I'm so glad. I'm so glad.
Yeah. I feel like we always tell people, or people always say, I wish we would have done it sooner. I mean, even my clients that I'm working with that decide to go to like a senior living community, they always, most of the time, come back and say, well, we wish we would have done it sooner because they get to enjoy all these other things that they weren't doing, or they're regaining some independence that they didn't have, or there's socialization or things like that. And even through those processes, these folks they're grieving different things, right? We're grieving moving out of a family home that they lived in for 30, 40, 50 years. We're grieving the loss of items and things that we had to part with because, let's be honest, our kids don't want it, and they don't want to let it go. And that's always a hard process to go through. So along with that, in the grief process, there's, I see a lot of pre-grieving with like Alzheimer's, and when people are going through that disease process, or even after a loved one passes away. So, and I know you guys offer great support systems for those types of situations. So talk about that a little bit and how you support the families during those processes.
Well, we're very fortunate that Hosparus Health has just an amazing grief counseling center. It's a new center that's just been open a couple of years. It's beautiful. But our bereavement and grief counselors are just absolutely amazing. And we can help with anticipatory grief. So just like you said, a lot of times the patient themselves is grieving their decline, the family members are grieving going on, and we can help with that anticipatory grief, which has been shown that there's not as much complicated grief after they lose their loved one. And then after someone passes away, we offer bereavement services for 13 months at no cost to the patient, to the family. And so we can be able to support them through that process. And that gets them through the anniversary of their death and all the firsts without them. But we're very proud of our grief counselors in the center that we have. We also have a space in West Louisville where we can also provide some grief counseling services at the YMCA on Broadway. So at all of our locations, we cover 41 counties. So we have offices throughout our footprint, and we offer those bereavement services throughout.
Yeah. And I've used those services, and they're amazing. Yeah. So, and we continue that care on as well, for our families that have experienced a loss that may not have been on hospice care. We provide complimentary bereavement and grief counseling support as well. Because grief it's a monster. you just never know, even a year out or 2 years out when that wave of grief will hit you. And just having the opportunity to have the resources in our community available for that, it's a lifesaver, truly, to have someone to talk to about those experiences, peers to talk to about those experiences. And yeah, it's a great help.
Yeah, I hope a lot of people take advantage of those. Take advantage of those
They
services.
should. Yeah, I think people try to be really stoic. I'll be fine. I can take care of this grief myself. But man, you don't have to. You don't have to.
I think something that a lot of people don't realize about hospice is we offer grief services to people that haven't even been on our services. So even if they didn't make that hospice referral in time, or they lost somebody due to an accident, homicide, suicide, we just feel like it's the right thing to do to be able to support the community. So we will offer those services as well, even if they haven't been a hospice patient.
That's wonderful. That's really good to know that even if they didn't use it, they still have those services available to them. And you guys have a new building or something, construction is going on right now.
We're
Do you want to
super
talk
excited. Yeah, so we have a new inpatient center that we're building, and it's going to be near our new grief counseling center that's off of Dutchman's Lane in that St. Matthews area. So we currently have an inpatient unit that is in downtown Louisville. But we are this is going to be our own building. It's going to be a beautiful space, a lot of outdoor area, all on one level. Downtown, it's hard because you have to park and then go up an elevator and get to our unit. And this is going to just be more centrally located. So we're very excited about that, just to be able to serve patients and families at our inpatient center.
And when do you expect that to be done?
So it should be done next year.
That's exciting.
Just drove by it the other day, and they're making great progress, and we just can't wait to be able to open it, and it's going to be a beautiful space.
I can't wait to see it.
I can't wait to see it either. Just can't wait to have that open for our
Yeah,
community.
it's going to be great.
So if anybody wanted to reach you guys to get some additional information or wanted to, reach out about hospice, health, or palliative or pre-planning, what's the best way for them to get a hold of you guys?
Best thing for us is just to go to our website, which is hospirushealth.org. And there it will have all the phone numbers. You can make a referral right there on that website. It's going to answer any questions about volunteering, grief counseling, our services. So you can go right there and get all your questions answered.
And for pre-planning and cremation services, dignitymemorial.com. I do offer complimentary consultations. I am mobile as well. So if you don't want to come to the funeral home, most people don't want to, I can come to you wherever you call home and provide that complimentary consultation as well. Or my Westport Road location is 502-426-9351. But I service all of the Louisville area.
Yeah. Well, I just want to say thank you to both of you for what you do. It's such an amazing service that we get to have in this community, and I hope people take advantage of it. And I'm always telling people, don't wait too late to start giving you guys a phone call and getting these services in place. And thank you so much for coming on here today and
Thanks,
talking to
Amanda.
me. I certainly appreciate your time and all that you guys do.
Thank you. Thanks so much.